As Joe mentioned about poetry, so I will start with the poem, and this is written by a Chinese poet from the 7th century. So he said that the white sun sets behind the mountains, and the yellow river flows into the sea. To see 1,000 mile view, go up another floor. So what's another floor in our context? Talking about humanitarian issues, humanitarian system, migration, refugees. One of the main issue is there's a need now to think about multiple shift of focus and to go from a state approach, more society, people approach, from within borders, invest and work and sort of research into cross border and which is something important. I'll come back to this later. And from the healthcare supplies into demand, from the official system into more an informal system, and understanding this informal system, from the barrel structure, barrel system now to the integrated. So in forced migration terminology, it matters a lot, and we need to pay enough attention to this. We know, talking about refugees, asylum seeker, and IDPs, and sometimes are stateless. But we know now life is different, or maybe more than just like a sort of very strict definition. There's a people in refugee-like situation and condition. There's a sort of people in need of international protection, and also people in IDP-like condition. And I will focus on all these issues on the IDP-like one. So not only the definition, but also using some sort of terminology, and failure to use the right one could bring a lot of trouble. We use a crisis when describing migration, and you've heard about this refugee crisis in Europe. And so crisis is when we think about migration, so crisis is the issue. We use the word legal and illegal people, moving around. People are not legal or legal, it's sort of the status is legal or legal, but people are people. So the other issues, of course, about traveling, smuggling, all these, issues, terminology that we use to say it without, paying enough attention to that. So just give some sort of numbers about the current situation. So by end of 2023, so 100 million forced displaced are registered at UNHCR, the main UN agency for refugee and displaced. So this number is even before the Gaza crisis. Because it was like in October, so early October. So we know what happened later. So among those 110 million, so 2/3 are IDPs and 1/3 are refugees. This is another important issue to, sort of. And the number, this 110, increased by 21% in 1 year. So when I moved to, I'm Syrian, I moved to Lebanon escaping the war. So when I moved to Beirut in 2013, the number at that time, I started working on the issue. The number at that time was a 40 million displaced population registered at UNHCR. After 10 years, we're talking about almost threefold of population. So it's always increase in a big number, and you can see that this is like a different countries with the top countries of migration and displacement. You see the number from 2010 into 2022. I mean, still, these countries are the 3 top countries of origin for refugees. Syria, after now 12 years of the war and crisis, like a 6.5 million, Ukraine and Afghanistan. So in Syria, 1 out of 5 refugees globally is Syrian. And interesting to see that they are in 131 spread around the world, 131 countries now Syrian are. In Afghanistan, 9 out of 10 are in Iran. And Ukrainian actual crisis went quickly within one year to have like the fastest displacement crisis since the Second World War. So this is the main interest when talking about refugees all around the world, talking about, 35 now million, 41% are children. 2 million actually was born as sort of refugee of the children, and 51 are a woman and girls. So when you see that by years since a decade, this is the ones or in green are IDPs. You see that one, the dark blue are refugees. This number with light one are Palestine refugees, which is a different category. Palestine refugees are not registered under UNHCR agency, but under different agency, it's called UNRWA, and that's why it's not counted in the number of refugees, like a specific category. We're talking about the issue of asylum seeker and people under international protection. Well, what's the current humanitarian aid system that, for a long time it was used? Mainly, that system is built around the experience of people or refugees that live in camps and from low-income countries. And the response is to do like a sort of direct intervention, like vaccination, clean water, shelter, and so on, and having like a parallel system to the international mainstream system. So this is the framework that we used to work in. Whereas we know now that we have different characteristics when talking about refugees. First, the issue of refugee or displacement has become more and more protracted. And protractedness is defined by UNHCR as a sort being in exile at least 5 years. Taking this definition, so 74% of refugees worldwide are in protracted situation, which is definitely different from the humanitarian response system that focus on the basic needs. It's also, unsolved situation. Also with the massive demographic change. In 1 month, like by the Gaza crisis started in October 7. By November 30, almost like 2 million moved from northern Gaza to southern Gaza. The situation in Ukraine also, in less than a year, we have almost 5 million moved internally. And the same with the Sudan, Rohingya, Syria. So it's a massive, but in a short time also. And this is a major challenge. It's mainly in urban settlement. So that model of being in camps become less and less, worldwide. And so 60% now of refugees are in non-camp urban settlement, and 80% of IDPs also are in urban settlement. And again, we know now that's become more and more in middle-income countries. That's the situation in Ukraine, Syria, Venezuela, Myanmar, Iraq, Lebanon. So it's the model, the expectation of people are different. And I give one example is that, I was in this debate when I moved to Lebanon, is the focusing on acute diseases or the basic, what they call it, basic needs. So just like having vaccination or having a sort of pills for diarrhea, but actually the major problem that we faced about the chronic disease, the chronicity, and actually it wasn't in the model of the humanitarian aid because, the expectation are different. And we know now, and we see it very clear about militarization and politicization of the services, including, of course, health services. Just in also less than 2 months in Gaza, over 400 attacks on health facilities that led to the death of 560 health workers. In Syria, in 10 years, more than half of health facilities, destroyed, deliberately destroyed, and almost 900 workers killed. And in Ukraine, over 15 months, we have over 1,000 that's attack recorded by WHO. And this is an example about protractedness. That's these countries, of displacement. Actually the date is from 18, and now nothing solved from all these issues. So you can add 6 years into all these issues, and some of the crises are between 35 to 40 years. So that's sort of protracted displacement. The Palestinian issue is it seems like without any future to solve. So it's sort of without end. But let me, as I said, focus a bit on the issue of IDPs, because it's, to some extent ignored from the humanitarian health system. This is in 10 years. Also, the number of IDPs increased from 33 million to 71 million. So in 10 years. And, 62 of them, 62 million, are, because of violence and conflict. Mainly, again, in Syria. So mainly from Syria, Ukraine, Yemen, and Colombia. Those are because of conflict. But we see more and more IDPs from disaster, whether natural disaster, including tsunami, earthquakes, and the estimate number is 8.7 million. But this one will be the most increasing number in the coming years. There's an estimate that by 2050, the number of IDPs because of climate change will be 150 million. So you can imagine that in the coming maybe 25 years, there will be a huge disaster because of the climate change. So why IDP health is also matters in in this issue, and why we don't have enough research on that. First, there's a bias in literature. When you go to literature, it's easy to see that the peer review research more on refugees than IDPs, and more on encamped IDPs. People are inside camp than people settled in local communities, and more on violence and conflict than natural disasters. So it's quite very, very narrow interest in terms of research, and of course focusing on mental health, and and we did that sort of review on mental health and other conditions. And when you go to ask why, so these are two facts that we know, that the refugees received 5 times more international aid than IDPs. And one example about the funding come from UK, from GCRF in the last few years. So 28 projects funded by GCRF focus on refugee and displaced and internal displacement. Only 3 have internal displaced population. So the interest is about the 1/3 for displacement, and the ignorance is about 2/3. And I guess you know why. Maybe we can discuss that. Well, this is some sort of framing this sort of IDPs. The most important to understand, IDPs are not, I mean, they are in a different context and having like a greater experience of rate of illness and death. What to do?
Green as well, right?
Arrows on the keyboard.
Yeah.
Well, thank you. So that to say, not all IDPs, are the same, and the example is second. So I will give like two examples about the issue of how to define IDPs. It's as I mentioned at the beginning, there's like a sort of different categories of displacement. One of them IDPs, but there are very tricky issue when coming to the real definitions. And these are two examples worldwide. One in Syria. So IDPs, as you know, are defined as those who didn't cross. They moved, but they didn't cross the international border. So any displaced person inside the international border, by definition, is an IDP. But this is not the case, This is not the reality. This is a Syria, the country now under control of different powers, This in red under the government power. This is the Kurdish power, Turkey, some sort of different non-state actors and so on. So the Americans here, the Turks are here, and so on. So people who moved from here, I mean, because many attacks happened in southern Syria, moved up. So they moved here or here. By definition, they are IDPs. By reality, they cross the border, the power border. So actually, they don't receive aid, which is the mandate of, UNHCR mandate commissioned the government, the local government, to give aid for internal displaced. But those who cross the border are not considered IDPs by the government because they didn't move outside, and not by international. There's no aid cross-border, but through sort of a different system now, and always this system could create a lot of political problem. Anyway, this is just an example to say that, well, so how to define people that live, the 5 million people living in this area. And next, please. And this is another. This is another example from Myanmar. So the government actually are in this sort of pink color. People living under this pink color under the government of. But those who are under that green are under different power. So they are still in Myanmar. They didn't cross the border, but they are, I mean, by definition, should be IDP, but usually they are. Next, please. Sorry.
No.
I feel guilty.
I'm happy.
So let's look into the health system, the traditional health system framework. So it's usually defined by the political geographical boundaries. So we have NHS system. We have a system for Syrian, in Syria, or the Lebanese health system, and so on. There's inside the boundary, the geographic and political boundaries. And usually they describe the users as sort of service, as sort of citizen. That means they have the right, those people have the right to demand accountability for government provision and a sort of oversighting the services. So they have this right of accountability, those users. Whereas in the same under the same structure or the same framework, those who are not citizens, refugees, displaced, stateless, they don't have the right to demand accountability. So this is a major issue when thinking about the health system framework. Next, please. That's the very famous 6 building blocks, and And I mean, it's by WHO. I don't want to. So in that system, WHO, and I think you're familiar. That's why I didn't stop there. So there's no space. There's no conceptual space about the issue of migration and and their contextual determinant of access to explore. There's nothing there in that concept, in that framework, and it clearly ignores the dynamic flow of people within and between jurisdictions. This is something that that's an important to think about, what I could call later. So this is a model to think about when thinking about forced displacement health, and this is a sort of framework to think about it. Usually the current situation is to do that when people are in the host community, in the host country. So that's the main sort of focus currently. But we know that the migration health is affected by the preconditions, when they were in the original place. So if this context suffer from conflict or economic factor or sort of limited access to social issues, so that the precondition is important, and the journey itself also is important. Whether it's like a regular journey, so they move and seek asylum, and so this is an important issue. But how long does it take, this process? What's about the stress during the journey is an issue. But if there's also major second issues about if they are irregular journey that have like either trafficking or sort of the how they cross. That many people cross the Mediterranean to go to Europe, and this is definitely this is a factor that affect their health. And of course the post-migration condition. I will focus here on the first line about their legal status. This is a very important issue when seeking health services. Different in legal definition means that different in access to health, and sometimes you don't have access to health. This is an important issue that we keep also ignoring because it's beyond health interest. And so that I hope someone here from the political science or from the legal entities that could give more ideas about that issues. And what we also ignore a bit is about the return process itself, if any. We know that it's small, but if any, there's also an issue of the return, and think about that. So there's a huge need now to analyze how the system is influenced by mobility, but also how mobility influences the health system. And this could be something to rethink about health system framework in time of forced migration and protracted crisis. We know now that this system is not more enough efficient to address people's needs. And that sort of suggestion to have a sort of these 6 building blocks to be not in parallel, but to be centered by people themselves. And that's also, to continue with this suggestion. So that model will go with the 3 levels: the geographic context, socio-economic context, and institutional, thinking not from only the supply side, but also from the demand side. So one example is about for example, demand side. It's usually in the traditional way, thinking about availability of services, like a sort of proximity of these services into the affected population. So how long does it take to reach the health center, for example? So you need to have available one. But usually from the demand side, it's also about the ability of individual to reach these services. 85% of Syrian refugees in Lebanon are without any legal documents. So legally, they are not refugees. They're refugees under UNHCR, but under the government, they are not refugees. So the main issue is not just transportation to go, which is an issue, but also the legal status, because if they move around their, their safe terrain, they could be, I mean, we saw that they could be under arrest. So it's not just the availability, but the ability also is something that is important to think about. And this is another, suggestion about the integration, how to integrate refugees in the national health system, instead of having like a parallel system to address the need of refugees as we know it. So it's important to look into different factors, the structural factors, individual community factors, and institutional factor to have like an outcome. It's difficult to know. So what are the sort of the future, say, priority for, I mean, not just for me, I think what we need to think about it to do research. There's a huge need to start having like a new conceptualized health system, considering the current human architecture. So the issue of governance, the issue of integration, cross-border, again, back to this issue of national system versus cross-border system. One example, again, I saw it in Turkey, Syria, Lebanon, and Jordan, is, all refugees there, or most of refugees, Syrian refugees there, but they are under different systems. So if someone, for example, I know the case that he needs renal dialysis, it costs that person, it costs UNHCR, if they want to pay, actually they pay 75%. If they want to pay, it costs yearly almost like a 10,000 US dollar. Whereas the same patient in Jordan, it costs them like a $2,000 to treatment. If in Turkey, it's almost free for people that under the government protection. So the same patient, the same nationality, to say that, the same situation, it's a different cost. So should we start thinking to go beyond the issue of national system into more broader regional system? This is an issue of a way of thinking about a different. Also, we need to have like a multidisciplinary approach. It's no more, migration health is just a health issue. So that should be a priority, to bring other disciplines and understanding their own tools also to bring it into the migration studies in general. So the funding mechanism, measuring success and failure, moving from accountability to donor accountability to affected population is another issue. The issue of localization and decolonization, another issue of thinking about representation for displaced population and giving them voices. It's not just about willing to do that. It's a very complicated issue, and how to be represented. When asked, for example, UNHCR, about that, they said, well, we represent them, but that's not true. I mean, they shouldn't be represented by agency. There's no representation structure for refugees, and that will lead to this issue of localization. The issue of labeling, power dynamic, privilege, politics, all these issues are major priority to think about it. We need also to have like maybe a new different method in approaching displacement and displaced population when the crisis is protracted and people moving a lot. But the tools that we know now, it's about, it's a short emergency and, people move in specific place. So we don't know exactly what to do when the situation is jump over 10 years, 15, 20, sometimes 7 decades, like in Palestinian issue. And, the issue of localizing here, or the participatory approach, should have like a more humanitarian approach. Like what I call it humanizing, research is is something important. And pluralistic approach with the issue to go, as I mentioned, beyond the well, these are few topics to think about: the role of technology, climate change, and climate refugees. Well. Okay. So you know that up till now, people who move because of climate change are not considered refugees, and this is a major gap, major debate, and that will be the new wave of migration in the coming 2 or 3 decades, if not before. So that's there should be like a more research on that. It's about also this famous nexus on humanitarian development and peace nexus. And the last one is about durable solution. We use this term since 51 convention, UNHCR convention, and then with the 67 protocol in Geneva about the durable solution. And the durable solution is so the durable solution as per UNHCR, so people have the right to be in one of the 3 solutions. Voluntary return, they should return to their original place, or resettlement to third country, third party, you know, or to be local integrated in their hosting country. These are since 51, maybe 67, 1967. Look to this number that by UNHCR that look into the period between 2000 and 2019, 2 decades. See these numbers. The return refugees in these 2 decades is 2%. The return IDPs is 5%. The resettled, with all this talking about resettlement and all these crises in the news, is less than 1%. And for what they called it now, local integration, it's something that discuss about it, it's less than 1%. So the main number, over like a 90%, are either IDPs, so without any durable solution, or refugees, of course. So it is still with this durable solution, we have zero research about to suggest something different. Well, also these 2 sort of very, for me, touching a project that I work on and hopefully I'll keep working on. It's about forced disappearance. So this group of population are not usually in the domain of public health. People that disappeared because of war, and we see that in Syria, 117,000 persons disappeared in the last decade, in 1 decade. So the whole issue around disappearance is not there. And so the project is to try to, to sort of fill the gap, the knowledge gap on how intersecting experience that affect well-being for displaced population. And, the project will be, mainly this project on women, because mainly women are the first target population or suffering from the issue of forced disappearance. What we call it the ambiguous loss, for those women. The second issue is about the transgeneration. So this, when talking about long term, so we're talking about, transgenerational, not just the trauma. I mean, in the term of what the PTSD concept that we know. We know that we have evidence that there's a huge impact, on different generations, even on their physical health. And I will stop here. Thank you very much.